Now, shifting a little bit to a mindfulness for the anesthesia provider, and why is mindfulness a thing in my lecture? Well, you know, as a student, as a resident, as a new grad, as a CRNA, we're trained to kind of hide things or demeanor, right? As an anesthesia provider, a physician or CRNA, you know, we're the ones that are always cool and relaxed no matter what's going on. And then but that doesn't necessarily mean that we are, you know, we're immune to stress, immune to chaos, immune to the damaging effect of our work. So what is mindfulness, right? Mindfulness means maintaining a moment by moment awareness of our own thoughts, feelings, bodily sensations, and surrounding environment through a gentle, nurturing lens. Obviously, you know, as a student, as a resident, you know, you're going through this right now and it's all stressful, you know, hopefully not, but sometimes preceptors are mean to you and physicians are mean to you. Very important to have this type of mentality. You know, this is not the end. This is not about you. It will be a better times for you in the future. You just want to make it through, and then just focus on the goal and focus on your health. It's going to be really important. And as a CRNA, new grad, you know, new CRNA, well, CRNA has been working already, you know, working in the SCT practices. You know, it's not everywhere, but there are practices that are really toxic. You know, that way, and you don't have, in your mind, you don't have the option to say, well, I'm just gonna take on and move. Sometimes that's not a possibility for many of us, and then so, you know, keeping in mind awareness of your own mental health it's even more important, because at least as a CRNA resident, you have an end goal, and then after that, you're like, I'm out, I'm going somewhere else. But if you're in a practice like that, I might just feel like it's endless. So be aware of it. You know, there's lots of resources about mindfulness, and I personally tell you, they're really important. For me, I can tell you that I promise myself to be just like that, right? Cool and calm, no matter what's going on. But I can tell you, I felt this, especially the bodily sensations, which it's no more than, you know, and the outside you look rock solid, taking care of your patient absolutely well. Everyone is freaking out around you. 3 in the morning, 4 in the morning, obstetric case, baby's not doing well, mom is, you know, intubated at this point because of bleeding and things like that. And then suddenly you start feeling your heart to race, you know, and at that point for me, it was like, well, what is going on? You know, I took a couple of deep breaths, brought it down, and then a few minutes later again. And, you know, that stuck with me. And I was like, what was that? Right. And it was that my body actually reacting to the chaos, not necessarily my cognitive part of me, but the body. And that was just really eye-opening. So take care of yourself. This is really important. And it applies to everybody, right? Again, through a lens of where you want to be and what's your goal at the end, right? Just do that. Focus on where you want to end up. Everything else is secondary. As a resident and as a CRNA in general, right? If you can't leave a practice that is really difficult to work at, no one is friendly, everyone tries to tell you what to do, and we know what type of practice are we talking about. Just focus on something else, you know? You're doing this because of your family, you're bringing a salary to them, you're bringing a living. If you're a CRNA resident, you know, this is not the end. Not every practice is like that. You can find practices that are excellent to work at. It doesn't necessarily need to be an autonomous practice. There are plenty of practices which are restricted, and there are DEFRA rules and ACT models, and the culture is just good, right? So don't lose hope about that. This, you know, again, as a student, as a resident, even as a new grad, use every opportunity to continue to learn, develop the skills, regional obstetrics, things like that. Even in restricted places, you know, you soft skills are going to help you a lot. You know, make friends with your preceptors, make friends with the MDs. Be nice to them, talk to them. You know, don't be afraid. And then creating relationships will help you to cross that bar, which is, you know, oh, now he's letting me do regional anesthesia. Great, keep doing that. Invest in your vision. You know, take classes, take ultrasound regional courses, and not necessarily too expensive. They're really useful. And then, you know, don't listen to those that say, well, CRNAs don't do regional. Oh, CRNAs don't do general, central lines and blah, blah, blah. You know, if you work in a place that you are not allowed to do it, it doesn't mean you are not allowed to do it somewhere else. So invest on yourself. So when you take this step, you're ready for it. Stand up for what is right and not what is popular. You know, and this goes for a lot of us. I think in general, as a resident, it's a little bit more difficult because you're, you know, under the watch and you don't want to, you know, hurt your own training, relationships. But, you know, sometimes there's nothing wrong with being the side of safety, side of a patient. Leave the politics to the side. So CRNA, you know, if you're a new grad, that's not a, you know, you don't have anything in that yet. You need to be able to concentrate on getting your reputation in good standing. CRNA residents is the same. Leave the politics for someone else. There's plenty of people that are fighting for that. Concentrate on your own, honing your own skills. And this goes to the same thing, you know, the job that you're in, it's broken, it's toxic, it's okay. You know, it's not your job to fix it. You know, if you're tired of where your environment is, just move on. And again, if you can't move on, then just concentrate on a different goal, a different focus on what you're doing. And then, you know, mindfulness comes into place in this type of stuff, right? Talk to yourself. Pump yourself, lean into your strengths. Forget about, I won't say forget about your weaknesses because it's important to know them, but don't necessarily like, you know, focus on your weaknesses because there are always going to be new weaknesses that we develop with time. We get better at good things, you know. Point is, you know, manifest good things for yourself and then be positive. I think this is, especially in the places in which, you know, the environment is difficult. So when we talk about transitioning to practice or independent practice, you know, you're going to find the same type of issues. You know, orientations are usually not the main point of a lot of these places, regardless of where you're a new grad in a university center or you're going to independent practice, especially independent practice. You know, they expect you to usually hit the ground running. We in our practice in Providence have fixed this a little bit, made it a little bit more longer or not necessarily longer, but more thoughtful, right? More mentorships, more thought out, couple weeks of introduction to many areas. And then, you know, assessing on our new grads or new CRNAs every once in a while to see how they're doing. Collaboration is very important, you know. Sometimes you have a lot, sometimes you don't have any. And then so lean into whoever is around you. I get a lot of questions sometimes about like, oh, well, what about you second hands? You second set of hands. And I'm like, well, listen, we have surgeons in the room. We have circulators in the room, techs in the room. There are second hands. Now the question is, are you able to use them? And that's important. Use whoever is around you. Collaborate with anyone that can give you a hand. Not necessarily has to be another CRNA or your attending physician. Obviously, if you work in an ACT practice, that's the first person you want to call because of obviously reasons. But when you work in an independent practice, don't feel afraid to call someone else and ask a question. Or when you're having an emergency, you know, don't hone in everything. Think about who can help you to do the little things, right? Lack of confidence is a big one. You know, we walked into a place and we don't know if we can do it. You know, That's a big one for us. And you're gonna have to fight through that one. First of all, because people have done it, you know. I can tell you from our own practice, we have 7, 8 new grads, different times arrived, and for different schools, different type of training, and they're all doing great. So if they can do it, for sure you can do it. And this is, you know, obviously in an independent practice transition, but even in a regular practice, you know, you're going to a different hospital that has a little more of a relaxed supervision. You know, just go slow and adapt to the place, and you'll be great. Feeling unprepared goes the same way. You know, lack of confidence and feeling unprepared are kind of similar, but in reality are a little different, right? I say lean into the resources that you have, right? Look for, you know, we have phones, we have apps, we have, you know where exactly where, you know, if you have a question about a disease or condition that you're not sure about, know where you're gonna go to look for information. High acuity patients as a new grads are scary, right? Because, you know, you're just figuring it out. Your basic anesthesia plans and things like that. Hopefully your practice is allowing you to do that at the beginning, and then you kind of like get higher acuity. But if not, then just go back to the basics, right? Safety is first. You know, your pre-op is huge, and then, you know, if you have to take care of these high acuity patients, just lean into your colleagues and say, hey, I have this question. What do you think about it? The responsibility is bigger. You know, this is a question that it gets kind of tossed around a lot. The responsibility is the same, regardless if you work in a restricted ACT practice or an independent practice. You know, you are an independent provider by training, and that's the way that the law sees you, the way that the law sees us, regardless of where you're working. So there is not really an increased responsibility. If you work in a ACT practice or an autonomous practice, it's just there's just less people to be involved in accepting this responsibility, right? Practices like independent practices are a little bit more efficient in the sense of there's no one just sitting there around waiting for you to do something or do something for you. So you're gonna have to be a lot more efficient. You know, we have 4 cases, have to pre-op the patient, do the case, do a block in between, and that's just the way it is. So obviously at the beginning it will be hard for you to do that. So don't feel afraid to talk to your supervisors or whoever is above. Tell, hey, listen, I need a little bit more time to be able to get there, and you know, they should be able to give you a little bit more time before they put you in those rooms that are high paced and require you to do multiple things like that, like, you know, pre-op, see the patient, do a block in between, see the next patient, and then so just you know, don't hesitate to communicate. Emergencies are big, you know, be able to do it. You have to use your soft skills, use your collaboration with the providers. Try to, you know, go through your list of things step by step, one by one, and then these emergencies never get better, but, you know, they get more tolerable and more predictable in a sense. Before the transition, you know, like I said, find the resources, right? Review your basics, reach out for your colleagues that you're gonna work with, ask questions about, you know, what to look for, you know, who to avoid, and things like that. Use resources like the Stanford Emergency Management. Now they have an OB one, which is really good breakdown of what to do for an emergency. If you feel like you need to go through it, go for it. Really good resource. Take a, you know, an ultrasound guided regional anesthesia course. Will give you fresh up applications like the Blood Body app, Astra app with the regional anesthesia for like coagulation things. Use all the resources that are available to you. You know, I'm telling you, I've been out of school for about 6 years, and no one is expecting you to know every single thing at all times, especially the things that you don't do all the time. So that doesn't mean you're not allowed to. You shouldn't actually go and look up resources, because that's where you find the right information. And the key is to be able to provide care for patients and that is evidence-based. So, you know, use use all those resources. And then getting down. So now you're working. You're in a new practice, a big one, small one, independent practice. Understand the service lines, right? Understand what the ortho services are, what they do, what type of surgeries they have. They do most often. Who is the leader in that group? Understand, do they like blocks? Do they like spinals? Do they like so understand what are you getting into, so not everything is a surprise. Create a surgeon preference log. This is really useful. Sometimes practices already have one. Ask for one. If they don't have one, then just is a really good opportunity to A, know the surgeons, B, know your coworkers, right? Because you can create a list and say, hey, I know this surgeon. What do you think I should know about them? And then just start making one. This is huge. It will help you to get to know a lot more people. And also they're actually probably going to ask you for it later on. Say, hey, did you end up doing that preference log? I would like a copy of it. So great thing to do. Find a mentor. So a lot of times practices will give you one, will tell you this person. If they don't, then I will advise you to do that. Someone who can actually give you advice that is non-judgmental. We do that in Providence. We try to assign someone there, and we tell the new grads, hey, listen, this person is going to ask you. You can ask them anything. There is no stupid question. There is no, judgment on them, because that's what you need at the beginning. You need to be able to have that type of outlet. Little tips on how to be successful in the first couple of months, first year. Use what practice feels comfortable with protocol. And this is interesting because I learned that in my career. And I hear that with physicians, you hear that with surgeons, you hear that with the medical education a lot. And it's just a way to kind of like ask and say, hey, I don't really know what you guys do here, but if the practice feels okay with using Precedex, what the practice feels like doing this case in here, because where I came from, we did this. So you can use that as a way to kind of like poke into people's experience or ask them for advice without sounding like you don't know what you're doing, which is really important at the beginning, especially because you're actually creating your reputation. Learn people's names. Big one. Your coworkers, but the nurses, the surgeons. It will ease the communication with them in the future. Your job is to make the communication as easy as possible with all your stakeholders. The nurses around you, because they're going to be communicating with you, the surgeons, your coworkers, even if you're working in an anesthesia practice team, the physicians that are supervising you or they're medical directing you, you want to have the best possible communication with everybody. It will just make you a better provider. Use the Where I Train protocol. This is also used to use it a lot, especially at the beginning, and that is the same idea. Of like, you not sure exactly where to go. You have an idea, but at the same time, you don't want to be wrong, especially at the beginning. So you ask someone who is more senior to you, and then especially in independent practice like the ones that we are in, you want to make sure that you look at, you don't look that you don't know what you're doing. So you can always say, and I hear this from surgeons a lot. They're like, hey, when I trained, this is what we did. What do you guys do where you train? And then you open the door for them telling you comfortably what they will do in that case without feeling like, oh, this guy's asking me a question and he should know that, right? Again, communications is a big one. Ask questions and ask for help. It's always good, but you know what? Don't do it too much, right? Why? Because it's your reputation that you're building on. So be really careful and the way you ask for questions and the ways you ask for help. Not to say that you shouldn't, you should, but don't do it for things that doesn't merit them. And then use your communication skills to be able to ask the questions and ask for help without looking or sounding like you don't know what you're doing. You're not competent and capable. Stick to what you know. Don't create a new system or a new plan or new way to use medications, because especially at the beginning, you don't want to have to sit down and a quality committee review of a case that you did something no one else does. Better be safe than fast. It's okay to be slow at the beginning. It's okay to take your time extubating. It's okay to take your time assessing the patient. Everyone expects you to be slower than everyone else. So use that, use that to be able to, feel comfortable. Simple is better. This goes for our non-opioid users, non-opioid opioid-sparing plans. Personally, I can tell you I use that a lot. But at the beginning, you want to make sure that everyone else is comfortable with what you're doing, because if something doesn't go the well you planning it, then explaining it or justifying it will be more difficult. So simple is better. Listen and observe what people do, what you're doing, and how that matches. Sometimes, coming in new, you are bringing new things that are working in other practices or in where you train, but necessarily doesn't jive with whatever the practice you are in. So make sure you listen and observe what people are doing. History and physical is your greatest weapon. And like I said earlier today, this is where it's going to make you or break you. So be really good at this. Finding information is great. Listen to your patients, auscultate, be an investigator, right? Because there shouldn't be anyone else in the room who knows better the patient's state than you. And don't feel afraid to call in the surgeon and tell them, hey, I have this problem, or I have this concern, and then let them figure it out. Okay, I'm uncomfortable with doing this. So this is a big thing for when you're counseling a case, for example, because you find something that makes you uncomfortable, and let the surgeon know that, hey, I'm feeling uncomfortable about this, right? And then if you get a pushback, then you can talk about it. Again, communication, relationships make this easier. Pre-op and PAC URNs are your best friends. So treat them with respect, know their limitations, explain things to them or educate them on things that they don't know much about, Precedex, regional, things like that. They really appreciate when you treat them as a professional. Again, and then, relationships and communications are huge. So they'll help you or they'll break you. And lastly, don't forget you're an expert, regardless of where you work. You can be in a very restricted environment or autonomous place, or obviously in a rural solo practice. You're the expert in anesthesia. You've done so many hours, so many cases, have the education, you've been through it. So trust your training. No one can force you to be unsafe. No surgeon, no attending, no nurse, no patient. So there are going to be times in which you're going to have to stop and think. I'm going to stand for that. And if it's for the patient, you will never be in the wrong side of anything. Express your concerns. Don't feel afraid to do that. And then blame sharing is free. So this is important, right? And then blame sharing, I mean, you're an independent provider, grab another independent provider and ask them, hey, what do you think about this? Grab your coordinator, who can be a physician, can be a CRNA. Hey, what do you think about this? I have this concern. What do you think about it? Grab your attending, your MD supervisor, come here, bring them in. Why? Because if something goes wrong, the least you could say is, hey, listen, I thought this was good, safe, consulted with a colleague, consulted with my supervisor, and we thought it was fine. It's just easier in the future. Things happen in anesthesia, and better to be able to at least, bounce this back with someone, and in the eyes of a judge, in the eyes of a commission, in the eyes of you for nursing, that's going to be really important, communication with other providers. And that's it. Thank you very much. I appreciate it.